Dear friends, at the outset, I would like to thank IOIs and Professor Janet Davis for giving me the opportunity to speak on one of this very challenging topic in the field of uveitis, which is on intermediate uveitis and what are the infectious and non-infectious masquerades or possible causative reasons for uh, intermediate uveitis. Now, when we speak about intermediate uveitis, we do know that vitreous is the primary site of presence of inflammation, which can be associated with or without retinal vasculitis, which can be associated with choroiditis or retinitis, or there can be macular edema. Around 15 to 20% of the patients presenting to any tertiary referral eye care center might have intermediate uveitis as the primary reason for referral, and it can be infectious or non-infectious in origin. Now, the Sun Working Group, the first meeting, has defined intermediate uveitis in way back in 2005, and it has defined and used the terms like pars planitis or posterior cyclitis or highlightis in the context of intermediate uveitis, and how do you differentiate anterior uveitis and posterior uveitis and pen-uveitis from intermediate uveitis. Very recently published the latest criteria in the Sun Working Group second meeting is that not all the cases of non-infectious intermediate uveitis without a systemic disease having snow banks, particularly in the context of intermediate uveitis, and the updated classification was published as presented here based on the presence of vitreous cells, based on presence of anterior chamber cells, and no evidence of associated retinitis. But there has to be certain condition which need to be excluded to be qualifying it as intermediate uveitis. Now, getting into the depth of intermediate uveitis as such, what are the patients, the symptoms what are the symptoms with which this patient can present? Most likely it can be bilateral, can be asymmetrical, but more commonly it is associated with blurring of the vision or the floaters, and there might be sudden drop in the vision secondary to any complication which might happen in patients with the intermediate uveitis. What are the signs? You can get anterior chamber signs, or you can get posterior chamber signs in the terms of vitritis, or you can get snowballs, which might be seen in some patients, but not necessarily in all the patient. You can get snowbank in patients with the chronic intermediate uveitis. On the retina, there can be presence of seething of the retinal vessel, which has to be carefully observed and picked up, and before you send the patient for ancillary investigations like FFA and all. And on those, you can see presence of ischemia or neovascularization. There can be complications in the form of cestoid macular edema or epiretinal membrane or optic disc edema, or in severe cases, it can be associated with retinal detachment. Now, coming to the topic for today, we needed to talk about the infectious and non-infectious masquerades for intermediate uveitis. So there are quite a number of those, and I will quickly touch upon some of those very important things which one need to be aware about in context of intermediate uveitis, in terms of infectious masquerades, in terms of non-infectious masquerade, and assess the masquerade conditions. What are the infectious masquerade? And we do know that, and this is a very typical exam answer where we say that tuberculosis can manifest as any form of uveitis. Here again, tuberculosis can be a very important differential diagnosis in the form of infectious intermediate uveitis. And with the COTS group, we did a lot of work looking at what are the possible signs of intermediate uveitis, what are the other etiologies need to be ruled out, and when do you start antitubercular therapy in these patients with the tubercular intermediate uveitis? And this entity was quite extensively discussed by the COTS group. Second important diagnosis can be the Lyme disease, which is not so common, but in different parts of the world, based on the geographical location, it can be seen. It is caused by the spirochetes Borrelia burgdorferi. But again, we are not going into details of it, but these patients can present with flu-like syndromes associated with arthritis or sometimes the neurological manifestations. And this also can present with intermediate uveitis with the presence of retinal vasculitis in the periphery. Syphilis, once again, as all of us know, is a great masquerader, and it does present, and I am seeing recently lots and lots of patients of syphilis with posterior uveitis or intermediate uveitis. You can have cat scratch disease as well, which can mimic patients of intermediate uveitis. You can have patients with ocular toxoplasmosis presenting as intermediate uveitis. You can have toxocariasis, which is luckily not so common, which can present as intermediate uveitis. And of course, the viruses are something which one need to consider in the differential diagnosis of infective intermediate uveitis, which can be any kind of virus, including the dengue, chikungunya, or Zika virus. It can also be secondary to following the vaccination, particularly the yellow fever vaccination. And I am sure a lot of you must be wondering about the COVID virus and the COVID vaccination. But yeah, in the context of intermediate uveitis, all this need to be considered. What are the non-infectious reasons of intermediate uveitis one need to think about, or non-infectious masquerade? The first thing which comes to our mind is the multiple sclerosis. Once again, you have to be particular in picking up these findings, but at the same time, take very particular directed history from the patients to elucidate whether the patients might have early symptoms of multiple sclerosis before sending them to your neurologist colleague. Sarcoidosis is a very common differential diagnosis. When you are confronted with a patients with intermediate uveitis, there can be some classical signs, particularly in the form of granulomatous reaction whenever there is a patient of sarcoidosis. There can be autoimmune diseases which may result into intermediate uveitis. Of course, there is a whole list of masquerade, but the top of the list of masquerade causing the intermediate uveitis is the intraocular lymphoma. The rarer forms are histiocytosis or amyloidosis or melanoma and metastasis. Luckily, these are not so common, but one need to be aware about an entity called as drug-induced, which also can present as intermediate uveitis. Then there are very other rare forms of the organisms which can cause intermediate uveitis. With that, I'd like to thank all of you for your patient listening and look forward for your questions. Thank you very much for patient listening.